Mr. Speaker, I rise to recognize National Rural Health Day. Every third Thursday in November, we observe National Rural Health Day. Nearly 60 million Americans live in rural areas, and too often they encounter limited access to primary care, specialists, and mental health services. These gaps are worsened by transportation barriers and hospital closures. These challenges don't just affect individuals, they impact the entire families and communities. Before I was elected to serve in the House of Representatives, I spent nearly 30 years in the nonprofit healthcare field, assisting those with life-changing diseases and disabilities. It can be challenging to obtain reasonably priced health care, and this is especially true in rural America, like much of the 15th Congressional District of Pennsylvania. As a member of Congress representing nearly one-third of the landmass of Pennsylvania, one of the most rural districts east of the Mississippi, I am keenly aware of the problems my constituents face when accessing medical services. We're facing a healthcare crisis in our nation's rural areas. These often disadvantaged populations are still struggling to access affordable, quality care. While these challenges are great, there have been a few positive developments in recent years that stand to greatly benefit these communities. For one, I want to commend the work being done at the Pennsylvania Office of Rural Health. This office has stepped up on a number of occasions to assist distressed health care facilities throughout the Commonwealth and continues to work on policies that will bolster rural health care for years to come. Additionally, I cannot overstate the impact and importance of expanded telehealth services. Throughout the COVID-19 pandemic, telehealth added tremendous reach and value to communities across the country, especially in rural America. Many of my constituents were able to access regular care, without having to drive nearly an hour in some instances, ensuring they could get diagnosed and treated in an efficient manner. To ensure this success continues, I reintroduced the Health Act, which will allow community health centers and rural health clinics to continue providing telehealth services and receive fair reimbursement for doing so. I also continue to support efforts to bolster our healthcare workforce in rural areas. One of the driving forces behind many shuttered hospitals, healthcare facilities, and other services in these communities is a lack of staff, whether it be physicians, surgeons, OBGYNs, technicians, nurses, or any other folks critical to providing care. As providers struggle to attract and retain a talented workforce in our rural communities, we must think outside the box to resolve these issues. For example, I support efforts to encourage medical programs to place residents in rural communities as a part of their education, training, and rotations. We know that people are far more likely to remain in communities where they train and serve, and we must continue to build this pipeline and solidify our rural health workforce. These policies promote access to care for all Americans, and I look forward to working with my colleagues to ensure equitable care in our rural communities. Mr. Speaker, in rural communities, health care costs have gone up, premiums have skyrocketed, but choices have decreased. That's not right, and it's not fair, and it's not feasible. There must be a better way, and I know that together we will work to find a stable transition to a 21st century health care system that works for everyone in America, especially rural America. Thank you, Mr. Speaker, and I